Hello, friends, and welcome to this podcast on one of the most exciting and interesting fields of medicine known to mankind, and that is the field of assisted reproduction. Infertility has been around for centuries, but it was about 42 years ago when, at the stroke of midnight on the 25th of July 1978, that the world had its first IVF baby. For the first time, clinicians were able to retrieve an egg from the female ovary, fertilize it outside in the laboratory in a petri dish with the husband's sperm, and put the embryo back into the uterus to give us the world's first IVF baby. Since then, the field has really progressed by leaps and bounds. Originally, it was advocated for patients with blocked fallopian tubes, but today practically every form of infertility, whether it is due to polycystic ovaries or endometriosis or even unexplained infertility, can be successfully treated with IVF or its related technologies. For severe PCOS, IVF with a freeze-all policy and transfer of frozen embryos works beautifully well. There are a lot of men who have very poor sperm counts, poor sperm motility, a lot of abnormal sperms, or sometimes even zero sperm counts. For these patients, we have a fascinating technique called ICSI, where we know that although a normal semen sample contains millions of sperms, finally you need only one good sperm to make one baby. So in ICSI, we take the eggs from the female ovary, we pick up one sperm. So even if the man has a very low sperm count, very poor motility, or it is retrieved by a testicular biopsy, we can inject that one sperm into the egg and make one human embryo and give the patient his own biological or genetic child. Also, there is a problem with more and more progress and more modernization and westernization. A lot of women are opting to postpone marriage, childbearing, and have children only in their late 30s and early 40s. A fascinating medical fact is that by the time a woman reaches the age of 30, she has lost almost 88 to 90% of her egg reserve. And this creates a real problem, because then when the woman wants or seeks a child after the age of 35 or in her early 40s, it's probably a bit too late, as the pelvic clock has kept ticking and the ovarian reserve is down to its minimum. For young girls who are pursuing careers or who plan to postpone marriage and childbearing, a good advice would be to please have your eggs frozen at a young age so that you can have your own biological child even later on in life. A lot of these women who come to us with a diminished ovarian reserve also have now hope with a lot of new techniques. For example, we do embryo accumulation, we pick up eggs every month, freeze the embryos for future use, or we have the use of adjuvants like DHEA and testosterone. We also have the new dual stimulation, which seems to be working well for a lot of women with a very low AMH, indicating a very low ovarian reserve. There are also women who are menopausal or who have had repeated IVF failures or recurrent miscarriages or some genetic issues with their egg quality. For such patients, we have a third-party option called egg donation, where they can take an egg from another egg donor, fertilize it with her own husband's sperm, and have it transferred to still have a baby. Similarly, for men who have absolutely no sperm even in the testicles, or who just cannot afford all these techniques of IVF and ICSI and all these modern technologies, there is sperm banking and the use of donor sperm, which could help these patients. Finally, there are a lot of women who are born without a uterus, or the uterus is damaged with a disease like tuberculosis, or the uterus has been removed for some reason and they would otherwise be unable to bear a child, and for them we have gestational surrogacy. Of course, the future is absolutely fantastic. We have a lot of new advances happening in the field of IVF with pre-implantation genetic diagnosis, stem cell research, ovarian activation, and more recently even womb transplants have been successful, which may do away with the need for surrogacy totally. Thank you, ladies and gentlemen, once again for being with me on this podcast, and I look forward to meeting you in the future too. Thank you very much.